Before talking about the key socioeconomic determinants, I would like to speak on the magnitude of the problem. Every day, around 1,000 women die from pregnancy-related causes, and of that, 99% of it is in developing countries. And this maternal and newborn mortality constitutes a silent emergency. And if you really look into the risk of a woman dying from pregnancy in a developed country to a developing country to a developed countries, it's 36 times higher. But there has been reduction in maternal mortality in last 20 years or 2 decades, and it's about 34%. A good news about Bangladesh, and a lot of people have spoken about it, that the maternal mortality has dropped down by 66%, but in the last decade, it's about 40%, and we are on track to reach MDG 5. Now, getting into the socioeconomic determinants, safeguarding health of women is important determinant and is dependent on many factors, and all these factors impact the health and status of women, and let me take you through each of these factors. First one, let's look into the access to education. In last 20 years, university enrollment in girls have grown by 7-folds compared to 4-folds of men. And despite these advances in education of women, still 35 million girls are still out of school today. If we look into the primary level, the good news is primary school parity have been achieved in most of the countries, excepting in some sub-Saharan countries where it lags behind. And if you look at Bangladesh, in girls it's around 90% compared to 82% for boys. Bangladesh has more women in secondary and higher education than girls, more girls than boys. If you really look into the green graph, if you really look into the green graph in 2010, it's really from 1994 to 2010, it's really gone up. And this green graph a lot of it is dependent on government's commitments towards education and the female stipend program that the government has for keeping girls in school and as well as in college. Educated mothers have more decision-making power and more access to health services. Now let's move to life expectancy. Life expectancy has increased in last 50 years all over the world. If you really look into it, it's only 17 years. Sorry, I just can't. And in the low and middle income countries, it's around 20 years, and Bangladesh has also done quite well. It's around 22 years. An increased life expectancy of women provides opportunity of accumulating human capital and improving the overall well-being. And now let's look into the women joining the labor force. In last 30 years, 552 million women has joined labor force, but it's only 40% of the labor force are still women. And in almost all countries, women engage in low productivity activities. Either they are self-employed or work in informal salaried sector. But all these numbers does not really translate to equal opportunities and also equal earning. So let's look at that. For every dollar a man makes, a woman makes. In developing countries like Bangladesh, 12 cents. In developed countries like Germany, 62 cents. Whether it's a worker, it's a farmer, it's an entrepreneur, whether it's a low, middle, or high-income country, the difference of wage still remains. And the most important determinants of women's voice in the household is her own income and her control over the assets and the resources. Now looking into politics or women in parliament, that also remains low. There are only 19% female parliamentarians if you look into around the world, that's a percentage. In Bangladesh, they're not doing bad, it's 18.6%. Whether you look into all the houses combined, upper, lower, it's still 19%. Now let's look into a Nordic country where woman has a very good status. It's also 42%. That really shows the limited participation of women in political process. Taking into consideration of political participation, women's political participation tends to increase the provision of public goods and improves governance. In India, what we have seen, women in political office has increased public investment in water. In countries like Nepal, they have increased conservation outcomes, and they have a greater say when they are managing the forests. And even in rich countries, women's participation helps to pass more family-friendly labor legislations. Now, coming to legislations. Enormous progress has been there in passing legislation. Almost all countries except 6 have really ratified the Convention of Elimination of All Forms of Discrimination Against Women. Yet, 510 million women are being abused by their partners in their lifetime. And so what it really shows that the countries have passed legislation against violence, but between the implementation, there is a huge gap. Now let's look into the gap, and let's look into how many of these women are abused. Looking into Bangladesh, around 42% of the women are abused during her lifetime. Look into a developed country like Japan, it's 13%. But if you take it into absolute numbers, it's 246,000 women. Can you beat that in a developed country like Japan? And these abuse impacts on her mental, social, emotional well-being, affecting her overall health status. Now let's look into the economic empowerment. Among the 1.5 billion world's absolute poor, 70% are women. And so eliminating this employment segregation, we can increase the labor productivity by 25%. And reducing the gender gaps in income can increase the well-being of the next generation and contributes to more rapid economic growth. These barriers do not go away with growth, as half of world's population is women, and not using these half of the populations or the women's skill and talents is costly for any country and as well as the world. And we have to eliminate these barriers, and eliminating these barriers would foster more decision-making power, and evidence from a range of countries including Bangladesh, has shown that increasing the share of household income controlled by women benefits children. Educated women invest more in children, and evidence from countries like China has shown increasing female adult income has increased girls' survival and increased years of schooling for the children. There's also evidence that women's income contribute to increased improvement in health-seeking behavior, leading to better access of health services. Now let's look into what we should be doing, the priority actions. There has been some progress there, but we need to put in more targeted action. We need to close the education gap, as education has a positive effect on women's health. Keeping girls in school really delays the age of marriage, delays the age of first childbirth, delays adolescent pregnancies, as well as an effect on maternal mortality. We need to improve on the access to economic opportunities, as economic opportunities leads to giving women greater voice in the society, greater voice in household decision-making, increasing their health-seeking behavior, as well as investment in children. We need to increase female participation in the labor force and in the control of their resources, because only in addressing economic opportunities is not enough, as women's control over resources tends to increase the well-being of the next generation and can contribute to more rapid economic growth. We need to also increase women's voice in political arena, because that really leads to more inclusive decision-making and better policy choices. And enforcing implementation of existing legislation would also reduce this abuse of the woman. We need to invest in women because they count. They spur economic growth and development. And the development is not only for themselves, for their children, for the society, for the community, and for the whole world. In closing, I would like to say again that we must address all these barriers because these women count, and we have to make it a success. We have to put all our resources and all our efforts to make sure that these women count. Thank you. Thank you. Thank you for listening to me and coming to this workshop and participating in workshop, because every woman and every baby counts. Thank you.